that when we get to those
Recording in
valuable
progress.
exchanges, that would help to facilitate that. So we'd like our online audience to join us as well as we introduce ourselves. So our name, what organization we represent, and one expectation from today. So our online audience, please, we'd like to hear you through the chats, your name, the organization you represent, and one expectation from today. Okay, and we'll just go around the table as well here. So I'll start from you, sir, if that's okay. Your name, organization, and one expectation.
Good morning, everyone. Chuku Kenneth Obinna, it's my name, from Good Governance Team Nigeria, Research Associate. My expectation here today is to really know how the health tax policy work and how it affects our health sector. Thank you.
Thank you very much and welcome. Over to you, madam.
Good morning, everyone. My name is Joy Zoho. I work for Options Consultancy Services as a senior consultant, health systems and financing. I would like to learn a bit more about the work that DGI has done and take some lessons away.
Good morning, everyone. My name is Steven Sekonda Dodo. I work with Corporate Accountability and Public Participation Africa as a project assistant. My expectations from today's gathering is more collaborations in ensuring the SSB tax is increased.
Good morning, everyone. My name is Gloria Oku. I am the program coordinator for Project Pink Blue, and I'm here representing my executive director. Project Pink Blue is a member of the National Action on Sugar Reduction, and I'm here today looking forward to learn from the research that is ongoing on these health taxes. It will really help us in engaging further with the government. Thank you.
Thank you.
Okay. Good morning, ladies and gentlemen. My name is Yakubu James Sumi, and I'm from the Federal Ministry of Health, the Department of Food and Drug Services. And I'm here representing the Director of Food and Drug Services, pharmacist, Mrs. Olubumi Aribiana, who is unavoidably absent. I really look forward to the findings of DGI and hope that these findings will help us to strengthen health tax policies in Nigeria. Thank you.
Thank you. My name is Dr. Malao M. Toma, the head Tobacco Control and Cardiovascular Disease, Non-Communicable Disease Division, Department of Public Health, Federal Ministry of Health and Social Welfare. I am representing the Director of Public Health, Dr. Chukuma Anyake, who is unavoidably absent due to exigencies of office. My expectation in this gathering is for us to see and palpate the outcome of these studies, and for us to have a united front to advance discussion on the best way to improve on the taxing system that will support health in country. Thank you.
DGI. Thank you very much. Okay, my expectation is to learn more about what is done on base of taxes and how we can use it in policy. Thank you.
I'm next. Yes. Thank you, everyone. I believe we have been introduced already. I believe this is a very useful meeting in terms of the topic for discussion, which fits in very well with an age-long quest on what to do with innovative financing for the health sector. So I'm sure we're going to learn more. So I'm looking forward to hearing the findings of the study that was conducted by DGI. Thank you very much. Let me give to Prof.
Good morning, everyone. My name is Professor Ladipo, President Emeritus, Association for Reproductive and Family Health. I'm excited about this meeting, and I'm anxiously waiting to learn about the outcome of the DGI investigation research. Thank you.
My name is Fumi Osiebu. I'm from Bondi's Care Support Initiative and a member of the NASR. And what I expect from this meeting today is for us to be able to get to the end of this is long overdue, to be able to adopt the SSB tax to help in the health. Thank you.
Hello everyone, good morning. My name is Shirley Ewang, Senior Advocacy Specialist at Gatefield. I'm also a member of the National Action on Sugar Reduction, and I share Ms. Fumi's expectations for this meeting. I'm eager to hear the outcome of the research that was conducted by DGI. Gatefield was also interviewed to be part of this research, and just also looking forward to hearing stakeholders' thoughts on, the health taxes in Nigeria as well as the SSB tax. Thank you.
Hi, good morning, everyone. My name is Omei Bongos Ikoye. I'm a Senior Communications Specialist at Gatefield, and so my expectations this morning are really to hear the findings as well of the policy analysis on taxes, and also for us to really define clear pathways on how SSB taxes can be used for real health programs, how they can translate into real health outcomes for Nigerians.
Good morning, everybody. My name is Bernard. My father's name is Matthias. My grandfather's name is Enya. I only add Comrade Bernard Matthias Enya. I am the second Vice President, Diabetes Association of Nigeria, and a co-chair of National Action on Sugar Reduction Coalition. I'm excited already with the combination of stakeholders that are gathered here, and I cannot wait to listen to the research findings and a robust collaboration and partnership where we can move these issues around tax in Nigeria to the next level. Thank you.
Good morning, everyone. Our elder, Professor. My name is Dr. Adamu Al-Hassan Umar. I am the president of the Nigerian Cancer Society, the umbrella organization for all cancer-related NGOs in the country. And I equally serve as the co-chairman of the National Action for Sugar Reduction. Today, I'm excited to be here because I am so excited to see the value additions that the findings from this study will bring out. Because we are talking about health policy, we are talking about data. Research is the actual ingredient. Data is the opium, is the petrol you need when you are igniting the data to generate policies that will lead to appropriate, timely, and result-oriented interventions. So I look forward to the robust discussions that will take place today. And I hope by the time we leave here today, we will be fully armed to engage policymakers, to engage lawmakers and the executives to do the right thing for Nigeria and Nigerians. Thank you very much.
Good morning, all. Professor Tanemola Konde. On this research work, I'm a senior policy analyst. My expectation is that I'm looking forward to robust input from experts and stakeholders that are here today. Thank you.
Good morning, everyone. My name is Ajibola Abdurrahman. I'm a researcher on this project. I work for DJI Consults. And my expectation, just like Prof said, is to get feedback, get inputs from the stakeholders present here to make the research findings, make it even more robust. And I look forward to that. Thank you very much.
Good morning, everyone. My name is Mr. Chibuike Mokore. I work with the Nigerian Tobacco Control Alliance. My expectation is at the end of this meeting, we will see ways to earmark the little taxation that we already have on tobacco, plow it back to control the harms and diseases that tobacco is causing. Thank you.
Good morning, everyone. I'm Dr. Kolapo Yeni. I'm the Director of Programs for Association for Reproductive and Family Health. And I'm here to represent my Chief Executive Officer, Dr. Kende Oshinowo, who is all avoidedly absent. I expect that we learn a lot again on health tax through the presentation of the research findings, as well as through robust discussions in the course of this meeting. Thank you.
Good morning, everyone. My name is Depunjoy Yembe. I'm an intern at Association for Reproductive and Family Health. My expectation today is to learn more about health taxes in Nigeria and also on the research findings. Thank you.
Thank you. Good morning, everyone. I'm glad to be here. My name is Dr. Nkem Omechili. I'm the CEO of Personal Solutions for International Development. My expectation for this morning at this event is really to understand the strategies or the approaches to be used for sustainable engagement with the private sector. They're the ones that this policy will be targeted at, and it will be interesting to know how we intend to get sustainable buy-in from that group. Thank you.
Good morning, everyone. I'm Bello Haliyu by name. I work with DJI Consults. My expectation on this today is to learn more on health taxes. Thank you very much.
Good morning, everyone. My name is Sarapa John. I'm a director in the Nutrition Department of Federal Ministry of Health. Well, my presence here today is to learn a lot about these health taxes, because a lot of partners and players in the health sector complain about multiple taxes. And it has made difficult the task of doing business in terms of providing these commodities in the health sector. So we are here, I can see a lot of my colleagues here, to know exactly what can be done. How do we harmonize these taxes to make it easy for these players to do business and provide these commodities to save life in Nigeria? Thank you.
Good morning, everyone. I am Irene Ominike. I'm a lawyer and I'm the senior legislative aide to the Senate Chair on Health at the Senate at National Assembly. I'm here this morning believing that I'll draw so much information and maybe at the end of this program get a balance point, just like the last speaker said, get that balance point to be able to get convincing outcomes and see that the full effect of this part of this policy dialogue is implemented, and we'll begin to see positive outcomes and results from the society and everyone at large. Thank you very much.
Good morning, everyone. My name is Sekina Sanusi, the Senior Program Officer at DJI Consults. So like my other colleagues have mentioned, my expectation from this policy dialogue is to get further inputs from the array of stakeholders that are present in this room, which will help us fine-tune the reports more than what we have now. Thank you.
Good morning, everyone. My name is Anna Daogo, and I work for Private Sexual Health Alliance of Nigeria. I'm the Director of Policy, and I think I'm hoping that after this, we can have action plans that we can actually work on. Thank you.
Good morning. My name is Kafayat Alawode. I'm the program coordinator of DGI Consult. My expectation for today is to get additional input into the report of the research and also to discuss ways in which we can improve health tax implementation in Nigeria.
Hello, good morning. My name is Akano Chamaka Adobe from Nutrition Department. I'm a Principal Nutrition Officer from Federal Ministry of Health and Social Welfare. What expectation? Okay, I'm just here to actually know what health tax is. Thank you.
My name is Ijidai. I'm from Gatefield. I hope that today we'll discuss like pathways that will help us get a bill for health taxes, especially the SSB tax.
Good morning, everyone. My name is Nasara Usman, and I'm also from Gatefield. And I'm hoping that today get to network with like-minded individuals and gain more insight into how we can push for a healthier Nigeria. Thank you.
Thank you very much for introducing yourselves, the organization you represent, and your expectations. I would also like to thank our online participants for giving us some input on that. Dr. Abani, thank you very much. Dr. Adeyeye, representing HCPAN, thank you very much for your input as well. Dr. Martin from the Alliance for Health Policy and Systems Research, thank you for your input. And all other participants online, thank you very much. Dr. Okoye, we see your response, thank you. So I think we can hear a lot of key words in expectations: acceleration, adaptation, okay, action, you know, and words like that, which is around how we forge forward faster. So I think we're all here for very similar purposes, and I look forward to us progressing those. As Professor said, this is very overdue, but also it's a continual conversation. It doesn't stop here. So I want to encourage us to make use of our social channels using the hashtag HealthTaxNIG and hashtag UHC. Please tag DGI Consult as you continue the conversation on health taxes in Nigeria. Thank you. I would now like to welcome for our welcome address, Dr. Gafa Alawode, Managing Partner at DGI Consult and Principal Investigator on the Policy Analysis for Health Taxes. You're welcome, sir.
Thank you very much, Ibim. And good morning, everyone. The pleasure is mine to welcome us to this very, very important event where we are discussing health taxes. But before I give my welcome address, let me build on the protocols already established. Permit me to welcome the representative of the Federal Ministry of Health here for the departments that are actually directly concerned with the issue of NCDs and health taxes. The Directorate of Public Health, the Directorate of Food and Drugs, and the other Ministry of Health representative are here. The directors were actually willing to participate but because of exigency of a duty. Permit me to also welcome our medical elders here present. I welcome Professor Ladipo, who is a veteran in advocating for health in Nigeria. I also welcome the brand new chairman of Health Sector Reform Coalition, Dr. Mohammed Leki, and our and our mama in the advocacy for health in Nigeria, Dr. Lola Mabogunje. And of course, a number of coalitions of organizations are here. Recognize the National Cancer Association of Nigeria, the Diabetic Society of Nigeria, National Action on Sugar Reduction, Nigerian Tobacco Alliance for being here. And then, of course, the Gatefield that is playing a very, very important role. Very soon, the representative for Federal Inland Revenue Service will join us, and Nigerian Customs Service. They are very, very critical to this conversation. And then, of course, I recognize others, Dr. Nkem, the Director of Policy at Private Sector Health Alliance, Dr. Ann, and some of our colleagues that are joining all the way from the United States, Daniel from the World Bank, who is the head of health taxes that are there. And then, of course, my own research team, which this presentation wouldn't have been possible without their dedication. I recognize them as well, and I recognize each and every one of us, and of course, the members of the media here are present. So on behalf of the management of our DJI Consults, I would like to welcome you all to this important policy dialogue. My special thanks go to the Alliance for Health Policy and System Research, ably represented by Robert here, who will be speaking to us very soon, for selecting DJI Consults through a competitive bidding process to conduct this policy analysis. As most of us know, taxation of products that are detrimental to health is not new. Some of them have been in existence for decades, if not for centuries. What is new, however, is the growing realization that these taxes could be deployed as tools for curbing excessive consumption of detrimental products, including but not limited to tobacco, alcohol, and sugar-sweetened beverages. Why historically, the purpose of such taxes was to raise revenue for the government. They are increasingly being used to achieve better control for non-communicable diseases now. Nigeria, like other low and middle income countries, is recording an increasing burden of non-communicable diseases, as close to a third of all deaths are now attributable to non-communicable diseases. Therefore, now is the auspicious moment to deploy every effective tool to tackle non-communicable diseases, including health taxes. To reform any system, we must be informed. Otherwise, we will deform it. In order to reform and not to deform, this is the reason why policy analysis for health taxes is conducted as a part of a multi-country analysis to deepen our knowledge about the concept of health taxes, to understand the status of its design and implementation in Nigeria, including the roles of stakeholders, and including enablers and blockers alike, in order to make informed recommendation. Let me remind us that the journey towards effective design and implementation of potent health tax policy will be more political than technical. And we have to prepare to tackle a lot of misleading, industry-driven narratives aimed at either weakening health, weakening or halting implementation of health taxes for commercial reasons, but often disguised as economic advice to the government, ministry, departments, and agencies. Therefore, it is extremely important to build a robust coalition of well-informed stakeholders across sectors in order to minimize their vulnerability to the misleading industry-driven narrative about health taxes. Moreover, we have to be more intentional about using health taxes to curb NCDs, and this has to reflect in the design of these taxes so that their rates, type, and structure of these taxes will enable us to be appropriate for achieving the objective of health taxes. Furthermore, having a robust and accessible database for the targeted product is very crucial for monitoring baseline consumption level, including effect of taxes on both prices and level of consumption, as well as generate evidence needed for policy adjustment where necessary. If you ask me, what does success look like at the end of the day? In my opinion, the whole endeavor will be adjudged successful if the result of this policy analysis, including its recommendation, are able to spur us to build a coalition and forge a consensus that will accelerate the design and implementation of potent health taxes policies that align with the global standard and reflect the country reality. I'm glad to inform you that we are already making progress in this direction, as our interaction with stakeholders, especially the National Action on Sugar Reduction, is generating some momentum towards the design of a draft SSB bill, which will soon pass through legislative process at the National Assembly. This milestone is a testimony to what we can achieve if we collectively deploy evidence to inform policy reforms. Finally, I would like us to leverage this forum to form a formidable and broad-based coalition that will deploy our collective knowledge and will to accelerate progress on design and implementation of effective taxes. Remember that the power of idea is not potent enough until it's able to influence the idea of power. Thank you very much. I wish us good deliberation.
Thank you, Dr. Gafar. We will now have our opening remark from Dr. Robert Martin.
Good morning. Can you hear me?
Includes how we leverage health policy and systems research to manage NCDs. Dr. Roberts, you are welcome.
Thank you very much for the warm welcome. Can you hear me?
Yes.
Okay. Well, good morning, colleagues. I'm delighted to be here with you online. I'm sorry I can't be with you together in the room, but I've listened and enjoyed hearing all of the introductions. It sounds like a fantastic group. I hope the next time you do this, I can come and join in person. So as you heard, my name is Robert Martin, and I'm based at the Alliance for Health Policy and Systems Research. We are a WHO-hosted partnership. We know and believe that health taxes can save lives, they can raise government revenues, and they can improve equity. But as others have mentioned, we also know that they directly conflict with commercial actors' interests. Both pro-tax health advocates and anti-tax industry representatives often seek to frame health tax policy. And we know that a lack of appreciation for political challenges can limit our ability to adapt and adopt health taxes. So we know that there's a kind of growing need to understand the political economy, the political policy process around health taxes. And so in 2021, we at the Alliance, with support from the government of Norway and in collaborations with other partners at WHO and the Interagency Working Group on Health Taxes, established a research program to provide and support health policy analysis on health taxes in 8 countries. We added another 8 countries to this program in 2023. And I'm delighted to say that Nigeria is one of these. And this work is being led by Dr. Gafar Alawade at DJI Consult. So very nice to see you and hear you, Gafar, and excited about all of this work. I know pulling together this meeting has been a tremendous effort. So congratulations and kudos to you. This work in Nigeria, but also in the other countries, is intended to develop case studies, understanding, examining how political economy factors influence and frame health taxes. And the idea here is not just to understand that, but really to help us to be able to improve their design and adoption and implementation. And we know we have compelling evidence that taxes are one of the most effective ways to reduce the consumption of unhealthy products. Ideally, these taxes are part of a strategic public health approach. I think, as others have mentioned earlier, health taxes can help reduce the deaths globally of non-communicable diseases, which currently kill more than 40 million people a year. From a combination of taxes on tobacco, alcohol, and unhealthy products. At the same time, we know that despite this overwhelming evidence, the implementation of health taxes remains underutilized, underimplemented. For example, in WHO's 2021 report on the global tobacco epidemic, it found that only 13% of the world's population is protected by tobacco taxes at best practice levels. Taxes on alcohol and sugary drinks, SSBs, are even lower. And governments around the world are missing out on an efficient, cost-effective opportunity to improve health, raise revenue, invest in equity, and save lives. And so with those kind of framing comments, I want to wish all of you all the best. Again, I really wish I could be there together with you in the room, but I'm looking forward to hearing about the discussions from the day and hopeful that this dialogue, this conversation is really helpful in accelerating Nigeria's efforts to move forward, to advance, to implement health taxes to improve lives. Thank you so much.
Thank you, Dr. Roberts, for that address. And again, we hear the words about accelerating. So I think we're all really excited at the discussions to come. But before we get into that, we know that the Federal Ministry of Health, as Dr. Gafar mentioned, is the custodian for initiatives that reduce non-communicable diseases. So it really is our honor today to have Mr. Yakubu JS from the Food and Drug Services from Federal Ministry of Health to give us our keynote address. Thank you, sir.
Permit me to completely align with the protocol that has been said already. I want to bring you special greetings from the Director Food and Drug Services of the Federal Ministry of Health and Social Welfare, pharmacist Mrs. Olubumi Aribiana, who until over the weekend had planned to personally grace this very important policy dialogue on health taxes in Nigeria. But for exigencies of her office, some things came up and it turns out that she will be unavoidably absent. And so she sent me here to represent her. Want you to also accept that I do not in any way fit her shoes, but I will just do my best to represent. It is very important to point out that at the Food and Drug Services Department of the Federal Ministry of Health and Social Welfare, we strongly believe that health products that somehow affects the health of the public, e.g. the tobacco, alcohol, and sweetened beverages needs to be taxed, if not for anything, to discourage the consumption of these products, or at least the excessive consumption of these products. And if these products are taxed, it is only I don't want to use the word commonsensical, but it is only logical. I think that's the word I should use. It is only logical that this money is so realized through these taxes should be used to strengthen the health system, so that these health challenges that are posed by these food products, these products are contained. And so at the level of the department, we are very, very happy to see the findings from this research that's so been conducted, and see the kind of policies that needs to be developed in such a manner as to ensure that these products are properly and appropriately taxed, and the proceeds from such tax used to strengthen the healthcare system. This is one area that we are very, very interested, and we really look forward to this research work that has been undertaken. We want to use this opportunity to particularly congratulate the WHO Alliance for Health Policy and System Research, as well as the DGI Consult for undertaking this research work in order to strengthen the Nigerian healthcare system. We really, really look forward to the dialogue we're going to have here, and the initiative that will come from this forum. Thank you very much, and wish us a very fruitful deliberation. Thank you.
Thank you, sir. I would like to call for goodwill messages. Dr. Alassad Omar, please, the chair of the National Action on Sugar Reduction. Thank you, sir. Thank you, sir.
Thank you very much. Good morning once again. Let me write on the already established protocol. I'm standing here as a co-chair of the National Action for Sugar Reduction. So before I start, let me say this. In the opening remarks, Dr. Gafar categorically mentioned the importance of coalition building, the relevance of coalition building to achieving the desired objectives. Looking at the flyer behind me, I noticed that I am somewhat related to all the entities listed. I'm a member of the UHC Forum. Getfield is my family. National Action for Sugar Reduction, Alliance for Healthcare. Federal Ministry of Health is our mother. DGI Consult. I have been part of the DGI Consult family for quite a while. That's the essence of collaboration. That is the essence of coalition building. And so this very gathering is very germane, is very timely towards achieving the desired objectives. So I'm standing here representing the National Action for Sugar Reduction, and I have a very short goodwill message that I'm going to present on behalf of all of us at the National Action for Sugar Reduction. It is a coalition, of course, comprising of so many entities, all working around non-communicable diseases, and of course, healthcare in general. So this is a goodwill message presented by the National Action for Sugar Reduction Coalition at the policy dialogue on health taxes in Nigeria, held at the 3Js Hotel, Abuja, today, Tuesday, 14th of May, 2024. Distinguished colleagues here present, it is an honor to be invited by our major partner, DGI Consult, to be part of this great event. The National Action for Sugar Reduction applauds the leadership of the federal government through the Federal Ministry of Health and Social Welfare and the contributions of stakeholders towards the prevention and control of NCDs in Nigeria through poor health taxes. We are delighted to see the Nigerian government's commitment to tackling the burden of non-communicable diseases and their modifiable risk factors. The National Action on Sugar Reduction Coalition continues to leverage on key political opportunities to strengthen the effective implementation of the pro-health fiscal policies. Since the introduction of the 10 naira per liter tax on sugar and sweetened beverages, the coalition has continued to advance efforts to sustain and increase these taxes, which has come under increased pushback from the beverage industry and its powerful allies. The National Action for Sugar Reduction Coalition also continues to conduct media advocacy and communications activities to grow public support and policy maker action to enforce effective health taxes. There remain huge gaps in healthcare financing in Nigeria. Poor and vulnerable populations cannot afford the high cost of managing non-communicable diseases. Yet, they are the ones who often depend on these sugar and sweetened beverages for sustenance. Our advocacy and health education efforts must be amplified. It is therefore expedient for all hands to be on deck to addressing these gaps as we target to achieve universal health coverage for all Nigerians. I want to use this medium on behalf of the National Action for Sugar Reduction Coalition to express our profound appreciation to DGI Consults, the Federal Ministry of Health, partners, and to ensure all present here that the National Action for Sugar Reduction will continue to intensify advocacy efforts towards policies that improve the health of all Nigerians. We look forward to a great outcome that will clear the pathway towards drastically reducing the burden of NCDs in Nigeria and towards achieving universal health coverage. May God bless you all. Signed, Dr. Adamu Alhassan Umar, on behalf of the National Action for Sugar Reduction. Thank you very much. Dr. Gafar, sir, I want to say this before I go down. This gathering, there is always something I amplify whenever I attend a gathering of either 5, 10, or 20 people, or even 100, that it is not the crowd that matters in every gathering. It is the quality of the crowd. When I stepped into this room today and saw the likes of Professor Ladipo seated, saw the rise of Dr. Leki seated, and other notable personalities, I said this policy dialogue is already a success. Sir, in this room, there are the 3 arms of government, not the 3 arms, in terms of health advocacy. Not only 3, we have 4. The government is represented, the executives. We have the legislature also here present. The advocates are also here. That's us. And we also have the private sector. And of course, the ingredients, the pepe that we need, partners are all here. So, sir, this meeting, this dialogue is already a success. We look forward to hear the beautiful outcome of the research. We look forward to hear the beautiful next steps that will take us to the promised land. Thank you very much.
Thank you, Dr. Rama. We really look forward to the pepper that will enter all the spicy food already that's been prepared. So we're very excited for the conversations to come. From the Federal Ministry of Health, we are also honored by the presence of Dr. Malau Toma from the Public Health to give us keynote address in the absence of unavoidable absence of Dr. Chukuma Anyaike. Dr. Toma, thank you for joining us.
Yeah, I'm so delighted to wear the strap, not the shoe, of the Director of Public Health, Dr. Chukuma Anyeke, who is unavoidably absent, as I've said, due to exigencies of duty, and had asked me accordingly to represent him. First, permit me to recognize profusely the representative of the National Institute for Cancer Research and Treatment, NICRAT, and representative of directors in the Federal Ministry of Health and Social Welfare, particularly the Director of Food and Drugs Services, ably represented here. And I also recognize deeply Professor Oladapo, who is the chair of the Association of Fertility and Reproductive Health in Nigeria, and our former Director of Health Planning and Research in the Ministry of Health, who I'm sure some of you might not know, had contributed immensely in the drive of health system in Nigeria. Dr. Mohamed Lekki, he is the chair of the Health Sector Reform Coalition, and host of civil society representative here, ranging from Corporate Accountability and Public Participation Africa, CAPA. They have worked greatly, and the program coordinator for the Nigeria Tobacco Control Alliance is also here present. And of course, as the name implies, they have worked immensely in the areas of tobacco control in the country. And permit me to shorten the protocol. Let me recognize the organizers of this important dialogue. Dr. Gafar Olawode, thank you so much for extending this invitation. And I could recall clearly couple of months ago, I had interacted with some of the members of the DGI. So this is a very good moment for us to advance discussion around tax, because we all know that tax is compulsory. Once government makes a pronouncement on tax, people should pay tax, whether individual, corporate organization, and as the case may be, you have to pay your tax. And if you don't pay your tax, it's a punishable offense. So now, as taxes are collected in Nigeria, what do we make use of those taxes? When taxes are collected, what do we make use of the taxes? Many people would say, well, government pull the taxes around to pay salaries and to fulfill other constitutional responsibilities of government. Fine, it's okay. But from the angle of health sector, what can we use taxes to help in driving health sector? So generally, in health financing is poor in country. Financing for health is poor in country. We need to look inwards. We need to be innovative, very innovative. And one key strategy that has worked is using a proportion of the tax that government generates to fund health. And there are plethora of evidences that has shown that that works in so many countries. So if taxes work, then we need to begin to team up, work together to push all those taxes that government generates to fund health. So in pro-health perspective, there are a lot of products. There are a lot of products that are being produced in country that have deleterious effect to health. And people are consuming those products, ranging from tobacco, alcohol, sugar sweetened beverages, trans fatty acids, and the rest, and the list is large. If we are going to even streamline the first three, tobacco, alcohol, and sugar sweetened beverages, and to say of all the revenues that government is collecting from those through the consumption of those items, can a fraction be dedicated to fight the control of those risk factors? It works. So when taxes are applied appropriately, certainly it will help reduce demand and consumption of goods that adversely affect health. And it will also help to prompt switching. It will prompt switching to healthy alternatives. It will also help to increase revenue base for government. It also provides opportunity, as I've said, for us to plow back through earmarking a fraction of the collectible taxes to fund public health programs in country to control and prevent non-communicable diseases, which these products are largely the cause. They are largely the cause of these non-communicable diseases. So let us not preempt the outcome of this work that has been done. I want us to listen carefully to see what the findings are. But one thing I know, if we don't unite, we'll keep dancing around the circle without achieving the primary objective of health taxes. Because I know there could be a lot of arguments. No, it is the education sector that needs the money, not health. No, it is the sports that needs the money, not health. Then if you now do a tiptoe and look deeply, those products that people are consuming, where are they emanating from? What are they causing? Largely, they are causing non-communicable disease. They are causing non-communicable disease, ranging from cardiovascular disease, diabetes, cancer, chronic respiratory disease, and the rest. So, distinguished ladies and gentlemen, let me pause here to say that we are in the right track and we are making progress. Because I could remember vividly, development, Gatefield had done lots of work around this area. CAPA has done a lot of work around this area. And now we have Development Governance International Consult fighting in the same area. I want us to unite. I want us to unite. And believe you me, all those taxes that are accruing, where do they go to? If they go to the federation account, or if they go to consolidated revenue fund, what can we do? Who are the key stakeholders that we need to target to let them know that can something be done beyond this? Remember, the 36 states plus Federal Capital Territory is also interested in this fight because the fund does not come to federal government alone. So we need to target the appropriate audience beyond this conversation here. Thank you, and I wish us a very successful deliberation.
Thank you, Dr. Toma from the Federal Ministry of Health. There's clear evidence that robust health tax policies work, and that's part of why we're here today. Thank you. We'll now have one more goodwill message from Dr. Mohamed Lekki, please, Chairman of the Health Sector Reform Coalition for Nigeria. You're welcome, sir.
Good morning again. Let me say that we from the Health Sector Reform Coalition We're very delighted to be invited to this meeting. I want to say further that the theme and the purpose of this meeting rests squarely with what we do at the Health Sector Reform Coalition. What we do best is in pushing legislative agenda that deliver. For some of us and all of us that should be aware, if not for the Health Sector Reform Coalition, we will not have the National Health Act in today, Nigeria. If we can deliver on that very fundamental legislative health policy, which now governs the entire health sector, if we can deliver on that, the processes, the challenges that it took to arrive, took us a very long time. I don't want to talk about the number of years so that we don't get discouraged that this may take that equally long number of years. We will not have that National Health Act today. So the expertise on how to target the processes, how to build the right coalition, which one of the speakers, the president of the Center Cancer of Nigeria mentioned, the coalition is there for us to take this forward beyond this discussion today. What is required is exactly what is going to be done today, which is provided the evidence base to be able to do informed legislative advocacy, which we are known to do. So for those of you who don't know about Health Sector Reform Coalition, you should know it from today. You are invited to come and join as individuals. You're also invited to come and participate and join as organization. We are there, and this is coming at the right time. And I can assure you that we are going to make it part of our own legislative agenda advocacy in taking this forward. And we shall arrive at the result end much sooner than we expected. Thank you very much.
Thank you, Dr. Lecky, one of the chief advocates for what we're here for today. And our final goodwill message will be from Mr. Chibuke Wokere from the National Tobacco Control Alliance. You're welcome, sir.
Good morning, everyone. On behalf of the chairman of our board, Mr. Akimbode Oluwafemi, we congratulate DJI Consults for this because tobacco, as we all know, we have many doctors here, is the only risk factor that affects virtually all NCDs. The only risk factor that we want to mention any NCD, Mr. Tobacco is available. So we don't joke with it. And we'll say more, there's a panel, what we think about the taxation, the current regime, both the ad valorem and the specific. We know that it's not working when you look at tobacco control. But I would say we leave it when we get to the discussion, but just to say that this is a very apt discussion and we're taking it very seriously because we are looking at tobacco taxation from the angle of demand reduction. Other risk factors of NCDs, they may have any benefits. Yes, a doctor can tell you take little glucose or this and this, but I've not seen any doctor that have told any person take a stick of cigarettes. That shows that that is a very, very important risk factor that I'll have to look into. And I have to say thank you, congratulations, Ministry of Health, congratulations, DJI Consults, that we are ready to continue to partner with you. Thank you.
Thank you, Mr. Walker. Thank you very much. I want to remind us online and here in person, as we know this conversation goes beyond this room, so please make use of the social channels, #HealthTax9 and #UHC. We will now break for our group photograph. So we'll just go towards, we'll follow the photographer, sir. Here, okay. So please, can we come forward for the group photograph before we go into art? Okay, great. So I've been informed that there are a few people who've joined us after the introduction. So before we come forward for the group photograph, I will just ask them to introduce themselves, name, organization, and one expectation, please.
Hello, good morning, everyone. My name is Ugochukwu Munachi, and I work with Christian Aid Nigeria. One major expectation I have from this meeting is learning about the findings from the research and how we can put that information to use in particularly promoting health in Nigeria. Thank you.
Thank you. Sir?
Good morning, everyone. I am Dr. Osito Okonkwo, the Country Director of Nutrition International. I'm happy to be here with my brother and to lend our support to the research and the outcome and see how that could be translated into action. Thank you.
Thank you, sir. Welcome.
Good morning, everyone. My name is Chima Onoka. I'm here on behalf of Senator Banigo, the Chair Senate Committee on Health. Hope to hear the evidence from, the work that has been done. Thank you very much.
Thank you, Prof. Chima. Please, is there anyone else who hasn't introduced themselves? Okay, so I think we'll now begin to make our way to the front for the group photograph, please. If we can begin to make our way to the front for the group photograph. Those online, you can join us. Please, can we make our way to the front, please? Thank you. I'm going to stay by the stairs. Thank you, everyone. We will now just take a few minutes for a tea break. A few minutes for a tea break, please. Thank you.
So and of course went through the engagement process so that DJI became our grantee officially since maybe around February or thereabout. And so they've been part of the design from the start. And like with their experience working in other states, establishing, supporting similar insurance agencies and open healthcare development agencies and boards in other states, we knew that we could achieve a lot together. So they're part of we're also part of the design of the entire implementation plan for the grant. And then we had the idea for the grant, but by the time we engaged DJI, we developed an implementation plan together. And then they were the leading, implementer in terms of the organizational capacity assessment.
The Deputy Secretary of Gombe State Contributory Healthcare Management Agency. And we just wrapped up a 4 days workshop facilitated by Development Governance International to build the capacity of the Rural Health Technical Team, as well as the board of the